Hello guys, my name is Roman and I've had a laser brain surgery for my epilepsy about almost 3 months ago. And that's how much it usually takes for minor recovery before you can even go to work and focus on things. Um, the reason why I'm making this video is because I've been trying to search um, as much information as I can about the surgery, and I chose a surgery because it was either this or getting my skull cracked, and you don't want that. You don't want to see a chunk of your brain about this big just go to waste and get thrown out. So basically, I decided to go with ablation laser surgery. Now, one thing you do have to remember is that the risks aren't that different. It sounds like a huge difference between a laser and getting a skull cracked, but it's quite the same for a risk for a brain infection and things like that. So, what I wanted to tell you is the surgery itself is not that bad. This was my first surgery. Now, the needle, the laser that's going to go in you and the catheter was a little bit deeper than I thought. Now, I thought maybe it'll go about, maybe 2 inches at the most. But then they showed me it was about this far in, going through the right side of my head, because that's where they found that my temporal lobe is basically active with my seizures. It was about half a foot. Now, of course, it heals up really fast. The thing is what they're gonna do first. They're gonna search where your memory is, and hopefully, it's not gonna be in the spot where your seizures are coming from. Thank God for me, the memory's on the left side, and I had a problem with my right temporal lobe, so that was a lot easier. That was a lot better, and a lot safer. You do have a risk of losing some memory. With me, I'm still having problems after 3 months keeping up with some memory trouble. But once again, I've heard sometimes it's pretty common after a major surgery, which is even a laser surgery, if it has to do with your brain, according to my surgeon, is considered a major surgery. So basically, all this is not gonna be fun. It's not gonna be fun for 1 month mainly. Now I had heavy depression before I went into the surgery, and you know what? If you've never been under anesthesia, it knocks you out like this. I mean, you don't freak out. I figured, oh man, maybe I'm gonna stop breathing or something's gonna go crazy. Everybody says, hey man, you're gonna feel nauseous. You're gonna throw up afterwards. No. As soon as I woke up, I felt, hungover, except I did not feel nauseous. What I did want is for my mom sitting right next to me to go ahead and get me a Whopper. So that tells you right there, not everybody has that feeling. It depends what anesthesiologist, does their job. Now, I got this done at the University of Miami, which is a great place, which is one of the top places in the United States, if not even one of the most famous places in the world to do these type of neurological surgeries or effects. Here's the thing. The surgery itself, the after effects are going to be just as bad as a surgery where you would get a chunk of your brain removed. Now, the chances aren't as high of you completely getting rid of your seizures, but it's a little, you start thinking, okay, whether it's my skull cracked or is it going to be a laser? And once again, it's the same risk. It's nothing, but I went with the laser, at least for now. You can always do the other surgery if this one doesn't work out. Here's the thing. Still till this day, it's been almost exactly 3 months. I'm still having auras. They're not that bad. Within the first month, you feel extremely heavy depression, to a point where you weren't sure if you would have actually went with the surgery the first time or not. It's extremely depressive, extremely hard, and I'm not gonna lie to you, while you're on those steroids, you're gonna be losing consciousness. It's a possibility. I know I've lost consciousness quite a few times. In physical form, it feels almost like you have to walk again. Now, as soon as you get off those steroids, you're gonna be going back to normal. It might take some time. It might take up to a month. But I had heavy depression once again when I went to surgery, and now I feel better than ever than I have since high school. I'm 25 years old now, almost 26, and I feel great. All my depression is gone. Everything. Now, don't forget, you're gonna have very heavy depression after the surgery while you're taking the steroids. Okay, they can ruin your appetite, they can ruin your day, your sleep, anything. I had to walk around my neighborhood holding my dad's hand. That was pretty embarrassing, but after the surgery and learning to walk again, well, learning, it's not that bad. You really don't care because you're somewhere else during that month almost. Um, but here's the thing: you are gonna experience heavy depression for at least a month while you're on steroids. Once you're off steroids, you're gonna go back to normal. Your physical activity is gonna get better. Do some minor things like do maybe 20 sit-ups daily, starting maybe a couple of days after you're off the steroids, and you are gonna start feeling better. After 3 months, you can go back to physical workouts, go to the gym. However, make sure that the weights that you would usually do, try to divide it in half. So if you're doing, 30 pound, I don't know, weights, do 15, maybe even as low as 10 for the next couple of months. It's not gonna hurt. Um, and then another thing is when it comes to work, you're gonna need time off. Of course, you're gonna need 6 months at least before you can even drive. But you know what? This has worked for me so far. Surgery is usually 4.5 to 5 hours. Mine took 6.5. I don't know why. But the thing is don't worry about the surgery. Surgery is not that bad. They knock you out, especially if you're a first timer like me. You wake up, you're not necessarily gonna be nauseous. I wanted a Whopper, okay? That's right after anesthesia. So don't worry about the surgery. This is my channel. I don't only put videos about my guitar or some stupid video clips. I don't even know what I have on here. The only reason I'm on here right now is to make this video. Um, I'm actually, one thing I am proud of is South Florida. After the side effects from the steroids and my depression, they noticed how obviously unhealthy and heavy it was on me. So what they did is in South Florida, they lowered the dosage of the steroid for the brain to heal. And I'm very proud of myself for doing that. I'm very happy. But if you are doing this, there is University of Miami. It's a great place, even if you're out of state. Just give them a call. Okay, just check it out, see how it is. They have the most success, the most knowledgeable doctors. Dr. Kenner is my neurologist. He's one of the best doctors in the United States. Look him up. Dr. Kenner Miguel. Look him up. He's in charge of the whole hospital, quite a few hospitals. He's my neurologist, and I'm very, very happy. Okay, if you do want to have the seizure, which got me diagnosed in a hospital, where I lay there for a little while for them to try to do some research to see exactly where I was coming from, please leave a comment, and I will send you a private video when it came to that, when they diagnosed me. This guy is great. These doctors are great. They specialize in all this stuff. You know what? Even the laser surgery is going to be as tough of a recovery as getting your skull cracked. Okay? So, the main thing is don't worry. The chances are about the same. Pain is going to be the same. Recovery is going to be the same. You might have more headaches, of course, because of your skull. You might suffer some migraines, possibly vertigo. I didn't get vertigo, but it's a possibility. Please go ahead and leave me comments. I will answer any questions you want. I will go ahead and make more videos for the ones that are interested. And the surgery, it's not that bad. It's not that bad at all. Recovery first month will be very tough. At least it was for me. But please go ahead, leave comments, questions, anything you have, and I will gladly answer absolutely anything, because I know how tough it was to find this type of information for me. You got a surgery coming up, you got epilepsy, laser surgery, any surgery has to do with the brain, as far as I can tell you. Please leave a comment once again, and I will go ahead and I'll respond on any comment, even if you want to say look like a dumbass. Alright, so thank you very much for paying attention to the video, and I hope to get some comments from you guys. Let me get a response, and just let me know how much this helped you. Okay? Thank you.